Hello again, everyone. Mark Hackle, Macomb County Executive. John Paul Rea, one of our deputy executives here for the county, giving you the update regards to COVID here in Macomb County. So how do the numbers look, John?
Mark, cases continue to increase across Macomb County. Now 4,970 cases countywide, 503 deaths. So we've gotten over that number, the 500 threshold. Statewide, over 35,000 cases and 2,977 deaths. We're still going through scrubbing the data with regards to the recoveries. We hope that number to rise over 900 this weekend once we get those totals in. And from there, we continue to update the information not only on cases by communities, also by deaths by communities, and still have that illustrative heat map as far as the spread of the virus around the county.
You know, what are your thoughts on it? You stop and you look at the numbers. It's almost like, 10% of the people, if you think about it, about 5,000 cases and almost, just over 500 deaths. Percentage-wise, that seems like, 10% of the people that have gotten tested for this, that tested positive, are dying or died. I'm having a hard time with that because I tend to think the numbers can be skewed depending upon the number of people that are actually testing. So, people, are concerned about that. They're saying, oh my gosh, does that mean, really 10% of the people that get it die here in Macomb County? I don't know that that's really the case. I just think there's some people that just aren't getting tested. I think that's the bigger concern.
Mark, we're looking at reported data that we currently have in our system versus larger community-wide metrics or numbers that haven't been tracked or cataloged yet. As we up testing, the assumption is that mortality rate will begin to decline drastically, but currently as we sit here right now around 10%. It's a concerning figure because obviously this is impacting a lot of those vulnerable populations, but as we put in a lot of those protective measures with the social responsibility elements in there, with the personal responsibility, social distancing, all those different types of things, the hope is those numbers will continue to decline, not only on the mortality rate, however, we're going to still see an increase in numbers across the board for the foreseeable future.
Yeah, but I don't want people getting kind of misled by that. Some will get concerned saying, well, is that the case? Well, even talking to our medical examiner, Dan Spitz, he said, it's interesting because even some of the reporting is somewhat, concerning or questionable. He had a case where it was an obvious suicide, and with that, they had to test the person and found out that it was a positive test for the COVID virus, and it had to be reported as a death related to COVID-19, which really wasn't the case in this particular situation. So, I guess I'd be very cautious when we talk about the numbers. The important issue is making sure that people are getting tested, knowing that there's still community spread, and realizing, that people do die if they end up catching this COVID virus. So we need to continue to make sure that we're social distancing, adhering to CDC guidelines and recommendations, and hearing what's going on from the health professionals or experts. So, don't be misled by the numbers. Just use that as a guide to the reality that there is a concern, in particular in Southeast Michigan here.
Mark, we're going to continue to not only look at them not only from a countywide perspective, but as we get more guidelines, not only from a testing perspective with regards to confirmed cases, probable cases, recovery. These are all numbers that are coming back and forth on a day in, day out basis. Again, what we see on the dashboard not only has been certified by health professionals here, has been vetted and analyzed by the state of Michigan too. So reputable numbers, reputable figures. But as you said, I think there's a larger unknown variable countywide. In a county with over 870,000 individuals, there's a lot of information that we're still very much going to have to intake and assess and understand what it means for our overall numbers and the spread of the virus and the impact in our community.
Yeah, so just go to macombgov.org for information, kind of get the facts and figures as we get them, and we present them based upon those that are giving them to us that are our health experts. So on that note, the governor did make mention today that she was going to extend the stay-home order until May 15th. Which I think many people anticipated or expected, and there was somewhat of an anticipation of kind of lifting some of the restrictions from non-essential. And we did hear from her today, and she did just that. Apparently, starting immediately, there are going to be some of these services that were under the restriction now kind of going to be opened up a little bit. Lawn care services, they're going to be able to open up. Motorized boating, that activity is going to be allowed. Golfing without actually utilizing a golf cart. And even some of those areas that were cordoned off in some of the big box stores, they're going to remove some of that cordoning off where people can actually now shop and buy some of those supplies, I guess, for gardening and other things that are going on. So it's a good sign, but we don't want people kind of getting complacent and thinking just because that happened, it's a free-for-all again. They still need to make sure they're following guidelines, and there are restrictions that she has put in place that will take effect Monday, immediately Monday morning. As morning comes, there's going to be restrictions about further wearing of masks and requirements for people to do that. And what did you have? Do you understand what that is all about?
Yeah, Mark, there's a number of different things. It's Executive Order 2020-59. We're going to get that up at macombgov.org. Ultimately, with regards to some of the loosenings of those requirements, obviously landscaping was one of the big ones that was discussed out in public. Whole notion with regards to the motorized boating, the golfing, some of those different elements that come into play. I think the retail element's going to be a little interesting with regards to some of the curbside options that they're allowing on there, online ordering, curbside pickups, how that happens for some of those that were previously deemed non-essential. Those things are all kind of illustrated out in a 12-page executive order. The facial coverings thing I think is going to be one of the more interesting things that we're going to have to analyze, not only from a county operations standpoint, but also from a public engagement standpoint. Whether it's going to the grocery store, whether it's going out to a recreational facility, whether it's engaging county government, all these things will definitely be a little bit, murky here within the past few days, but we're already working right now with our internal team in the Emergency Operations Center, also with our Corporation Council, engaging the Governor's Office to get those clarifications, to link you to the frequently asked questions on the Governor's page, and also again recommending that you reach out to the Governor's constituent line if there's any detailed questions that might impact your business, or your family.
Yeah, an important part of that is this is the Governor's order, so questions you may have, we're going to have a link to that as well as the frequently asked questions at macombgov.org. Please take a look at that because there are going to be a lot of questions. I mean, anytime you put an order in place, it's not very direct and very specific. There's still going to be some unanswered questions. We even have a few ourselves as to how it pertains to county government and or local government. So we're going to be filtering through that and even calling and asking some questions to get further clarification. But understand that this is kind of that first phase that we're entering into, and they're going to be studying the facts, looking at the data to see if there's any type of resurgence. And if there is, they're going to be pulling back, and understandably so. So again, that's why I go back to this, let's just not think it's a free-for-all. Let's still adhere to some of those guidelines, wear those masks. And the mask wearing thing I'm hearing is basically, it's not so much for the person that's wearing the mask to protect themselves from others. It's to make sure that, whatever you're transferring doesn't get to others. So it is important that you wear that mask if you're in a restaurant, grocery store, even just picking up food. Make sure that you're wearing it to keep those workers safe. That's, I think, what I'm hearing is the number one reason for wearing the mask is to protect others, not so much yourself.
Mm-hmm. Mark, it's the transmission and spread of the virus. What these safeguards will do is ensure that we have a concentrated protection element that's deployed through every individual that's in gaining just those that are in the general public right now. But again, adhering to those personal responsibility metrics, testing your own symptoms, looking at your temperature, doing those types of things for your friend and family will get us all just a better understanding of how this virus continues to spread.
And remember, it's the low-grade masks and or a bandana, cloth, one that's homemade, not the N95s. They're trying to save those for obviously medical professionals, first responders. So we just want to make sure people are being conscientious of that to help our healthcare workers. On that note, this has been an incredible challenge financially. Not only for those that own businesses and companies or corporations, people at home, dealing with the financial consequences of being laid off and not being at work. This has been an incredible challenge on budgets throughout the entire country. There has been a recognition because of the impact it's had to many communities. Specifically, the federal government has provided some funding. There have been the counties here, there are 4 counties that have been awarded some funding from the federal government. It's going to be Wayne, Oakland, Macomb, as well as Kent County because of the impact we've seen, as well as the city of Detroit and the state of Michigan. So there's a substantial amount of funds that came our way to help deal with this particular crisis. And here in Macomb County, it was about $152 million that we're seeing. But again, specifically, we're looking at it, assessing the criteria that surrounds it to make a determination how it can be spent and when it can be spent by. But it's not just giving free money to folks. It's got to be something that's going to be a reimbursement, assistance, as well as trying to figure out, how do we prevent this from the future. So we're making those determinations, talking to our grant folks, our finance department, our human resources people, as well as the emergency management team to get those answers as to how we can best deploy or spend some of that money that we got. But the main thing I'm looking at is, okay, how do we put things in place to be prepared to handle these type of issues if and when they come our way in the future?
Mark, tremendous amount of stimulus that's coming down from the federal government. Obviously, a lot of individuals getting those personal checks that are trying to stabilize those that are out of work or faced with some type of financial hardship. From a governmental operations standpoint, these resources are to come in to combat the reduction, whether it's in revenues or increase in expenditures, to combat this virus. There's a tremendous amount of compliance that comes through the U.S. Department of Treasury. Our entire financial team, and as you said, administrative team is starting to review those guidelines and figure out how we can invest those resources to not only ensure we're protecting the community here today to combat it, but very much how those resources can be used in the future also.
Yeah, so again, credit to our congressional delegation for recognizing the importance specifically here to Macomb County, but even Southeast Michigan. So, we're starting to see people are really stepping up and helping out, and we're fortunate, but also those that are in government positions recognize this concern, and they've been very good at making those contacts with us to kind of let us know, hey, we see the problem, what is it we can do, and to come up with $152 million from Macomb County specific, boy, I tell you, that's an incredible statement or testament to the work they're doing right now.
Much needed resources in a critical time for the county.
Yeah, and on another positive note, talking about things that folks are doing, we're trying to get not only meals to people, that food service, MacombGov.org, we have that designation on there with an icon. People can get the food resources that are necessary, but we're joining kind of food resources with the census information. So Centerline just did something, that Rising Star Academy, where they were providing food, meals for folks, and when they came in, they're also giving them information about the census, the importance as to why they need to fill that out. So later on today, they're going to be doing something over at Jimmy John's Field, very similar. Jimmy John's Field obviously is hoping to get back up and running, for their incredible, ballpark that they have there here in Macomb County. As the season is looking to start, they're going to have to wait until the governor gives the okay to do that. But in the meantime, they're stepping up to the plate and, as I would say, hitting a home run with us by providing meals to folks at their location. And again, reminding people about the actual census that's going on. So credit to Andy Appleby and his folks for allowing us to do that on his properties in the city of Utica, along with the mayor.
Mark, it's been a really great outlet, not only for communities to partner with some of those restaurants and operations that have been adversely impacted, where they can still get some critical resources out to the community with regards to Census 2020, but also provide a meal and a resource to those that need it too.
Yeah, so if you need some information, you and or someone else, about how to get food or get meals, please go to MacombGov.org, log on and look at the food assistance icon that we have there. And again, there's also information about the census. So if you haven't already, make sure you fill out that census. And we want to thank you once again for joining us for this update. And remember, keep yourself and your family safe.